right. Hey, everybody, thanks again for joining us for another great week, another episode. We've been busy, sometimes 2 or 3 episodes a week, but very excited about today. It worked out great. Got a special guest, and we got an upgrade. Mike's going to give me a hard time because he's out of pocket. Yeah. So, I got a new guest. It's not just Mike and I.
I'll try to fill in.
Go ahead, Matt. Take it away. Introduce yourself. Oh, and by the way, you got to hold the mic a little bit closer.
Got to do it.
Yeah, a little bit. But take it away, man. Introduce yourself.
Yeah. First off, thank you for having me. It's great to be here. Glad it worked out. I am Matt Rau. I am the, title varies depending on who I'm talking to, but really what I do with Devoted Health is kind of work with our national partners, right? So a lot of time spent in distribution. So it's a good mix of, sales strategy, operations, a lot of different things. Looking for broker experience, RTS, you name it. We all wear a lot of hats. So
we call you VIP. You're a very important person over at Devoted Health.
Yeah.
Everything from what you could be called strategic growth to channel partners to national distribution.
It's been fun. Devoted's growing, right? Growing quickly. And so this is the evolution of distribution, right? Where you're in a few states, you can do things, on a smaller scale, but as you start to expand, you got to make sure that there's that continuity across your organization to some degree, right?
Yeah.
So, especially with these types of relationships, this is a small, tight-knit world that we live in every day, and, we want to take care of our partners. So
appreciate that.
I like, very much like what I do because I get to hang out with cool people, and this is just such a unique industry that we live in every day.
Right, and I was going to say, based on your comments, you've already probably seen Devoted change pretty dramatically, even over the last just year or two, right? Since being there, you talk about being a small carrier in a handful of states and the strategy changing and growing. There's already been a lot of evolution, right, I would imagine?
Yep. I mean, just in size, right? I think when I started, which will be 2 years at the end of August when I started. So I came in, basically they'd done all the hard work for the expansion in 2000, plan year 23. That was our last big expansion. We did 8 states, right? Mm-hmm. And so I came in and, I'd been on the distribution side of the business. And
you're going to talk about that?
We can talk about that. Okay. And thinking, just pick all this up. This will be fine. Never worked at a carrier before. Never thought I'd work at a carrier before, which tells you how unique Devoted is.
Which is why we get along great, because I always think, could I even work at a carrier ever? I don't even know if I could.
I know, right? And, but, we can go through that process too. But, so we go from 1,300 people when I was there to like 2,500 now. The wild thing is that we're in 48 states. We're like basically completely decentralized. Mm-hmm. So if you think about the timeline of Devoted from founding to enrolling your first member in Florida in 2019 to then you really start to scale and you start to expand in COVID basically, right? So everything happened and there's none of that pressure to go back in the office because this is how we grew. This is what we did.
Right.
And it's really cool. I mean, and the fact that this is a testament to the leadership and the buy-in that everybody has, the culture it's like nothing I've ever experienced.
Yeah, I would agree, and we're going to talk about that more and more we actually did, and if this seems regurgitated or a little bit redundant from some of our listeners, I'm okay with it because we did one kind of episode already about Devoted Health, and but the one thing I've noticed is your expansions, they've always seemed more obviously methodical. There was a lot of intention behind some of the expansions, and Devoted has done a great job to ensure not just network adequacy, but a really robust network. And it's almost like, hey, if we're not going to be able to have a stable, viable, great product, you guys just don't do it, right? And I've seen other carriers and brokers who are listening are like nodding their head like, yep. We've seen a lot of other carriers where they get like a stronghold. They have their staple markets. Like I would say for Devoted kind of legacy markets like Florida, Texas, Arizona, a couple kind of legacy markets. Yep. But then, and you have carriers who do that. And then once they start expanding though, their expansion efforts fall short. And then the products aren't as good. It's a lot of investment, a lot of pain for everybody involved. Mm-hmm. And honestly, I can say that almost every state that you've expanded into has been a hit, right?
Yep. It's generally been pretty successful.
And I bring that to attention because, we can't talk a lot of specifics in this avenue. Obviously, if you're listening, brokers, yes, you can go to our website. We can send you information. We have to kind of, verify your NPN, put it behind some security protocols. But I mean, we can't announce, but there's going to be significant expansion opportunities again this year, and not just states, but even in states where you already have existing product, there's going to be additional county opportunities this year.
Yeah,
right?
I mean, it's pretty crazy. Expansion, I don't think that personally I fully understood, right? Coming to a carrier and, thinking I was going to pick it all up. I remember my mother-in-law saying, it'll take you a couple years. And I was like, nah, I got this. And like, I'm 2 years in and I'm like, still learning some things, I mean, there's just a lot going on. And, but expansion is super, super interesting. What I think, at least from what I've seen so far, the consistency is what is the key to that expansion. Right. And to what makes it work is we go into a market with a 3-year kind of plan of we're not trying to win it in year one. We want it to be a grassroots growth effort, right? Where we have to get members, certainly, but we have to get brokers to fall in love with Devoted.
You have to get buy-in, I think.
And we want to be tested, right? And the only way to get buy-in is to be tested and actually do the things that you said you were going to do. Right. And so we're willing to take that long approach because that when you get to be tested and be consistent and show what you're going to do, then it all just kind of falls into place. And so same thing when it comes to like plan design, right? Is like you could certainly go in and buy membership in a new market with some crazy plan, right?
Sure.
But there's probably a higher likelihood that that's not as sustainable as you might like. And so, when we think about healthcare and what we want for what I would want for my family, because that's how, we have the prime directive of, if we were going to make a decision, close your eyes, how would you want that decision made for your loved one, right? Like, so when I think about that, I would want that stability, right? Like I'd been in Medicare for probably 12 years at one point where my grandpa called me and he was like, I saw this thing on TV and I called him.
Was it Joe Namath? Did you get a hold of him?
I think it might have been Joe. He might have talked to him. And I said, Grandpa, I do this. Like, why are you? Well, they said I should call because I got to get what I'm, entitled to or whatever.
It's going to give you a better deal than what you could probably, right?
Yeah. So it's like what I would want for my grandpa is to have that consistency where he doesn't even have to think about it.
Right. Yeah, it's awesome. And I think, the one thing that's refreshing about Devoted to right now, and part of the reason we really wanted to have you on, because contrary to what people think, it's challenging to actually produce a podcast every single week, involve industry influencers and kind of get people from legal and compliance to be able to come on to the podcast, as you can imagine. But we wanted to tell more of the Devoted story because as we look back behind the curtain, so to speak, there's a lot of positivity. There's growth. There's ambition. There's drive to get more members, to do better, to expand. And that is different this year, the dynamic. I mean, candidly, a lot of carriers right now, and I'm not naming any names, but there's carriers out there right now that when we are having conversations, it almost feels like a funeral. It's like this, the sentiment is different. It's kind of, the tone is different. They don't want to talk a lot. They don't want to say a whole lot right now. It's a weird dynamic in the industry right now, which we'll talk about a little bit more, but the dynamic is very different this year from others. Yeah. And so the fact that Devoted's like, no, our foot's on the gas. We're going to grow. We're going to expand. We have all these new states. We have these new counties. We have these very competitive products. It is just refreshing. And I think it's great for, agents to be hearing that, and it's not all doom and gloom, and that it's not all just negative. Yeah.
And I think, don't get me wrong. It's nice to have a good, that narrative right now, right? Growth in a time that we're seeing more retraction. Like, there's reasons. It's not like every carrier wants this stuff to be happening, right?
No.
Like, this is it's a compounding of so many different things coming out of COVID, and utilization goes up. You've got, changes to PDPs, you've got, V28, you've got, like all these different things. So there's all this stuff going on in the background. And I think looking back on it, some future state, I think we're all going to understand how difficult of a time period, probably even like the last 5 years has been, certainly the last 6 months have been a grind for a lot of people.
This has been like a culmination of things brewing for years,
yes, right? And so it's one of those things that it sucks while you're going through it.
Yep.
Kind of got to embrace the suck, I guess.
Yeah, I like that.
And then, but you're going to look back on it, and I think we're all going to be better for it. And I think most importantly, we'll be better for the members. And for everybody that we're all trying to serve. Agreed.
Like we had conversation kind of off camera. We were talking about things before and, healthcare and, our healthcare system and what Medicare should be and what, an insurance plan should be and what it should be accomplishing. And I would say that that's one of the things that I think brokers sometimes, because, our job is to obviously, understand the assignment, and we need to educate and train brokers. And ideally that broker is out there educating the member and finding great solutions for them. And I think that overall, when we really look at what's the goal, what's the objective, the industry at large has fallen short of that over the last, 5-10 years.
Sure.
I don't think that the consumer really appropriately understands what they should be looking for in a product, how they should be utilizing their plan, how to access healthcare, how to get the most out of their plan benefits, because I actually don't even think most of the brokers understand it well, candidly.
Sure.
And so I think that that's one thing that we really like about Devoted's model and kind of ethos and their mission and what you all are trying to do there, getting back to healthcare. Yeah. So let's there's so many good feel-good stories about Devoted from, the leadership team is different. I would say the broker experience is different. The member experience is different.
Sure.
So where do we want to dive in and start?
Any of it's good for me. I mean,
yeah. Hey, by the way, you're getting off easy. Some people I would like to bring on here, and it's not going to be quite like, the head of Secret Service getting grilled in Congress.
Yeah.
It's not quite that heavy, but maybe somewhere in between.
I mean, I hope you would have warned me if we were going that route, but no, I appreciate that. I think it all starts at the top, right? And wherever this leads, the tone is set by Ed and Todd Park.
Yep.
Right? And
who, by the way, super accessible, down to earth, great leaders. Just they have a very different just aura to them. Very humble and accessible people, which are awesome.
It's unbelievable, right? Like I could go down some stories. I did a webinar about 3 weeks ago, and I asked Ed if he would join me, and he always does, or at least he'll try to make it work. He called. I didn't even realize this. He was in Hawaii. It was 4 a.m. He got up to do this webinar.
I'm not surprised.
No,
yeah.
I mean, but it's like you don't want to start taking that for granted,
right?
Because it's just, I've been on the road with him where somebody said, this would be like a really great idea if we could, do something like this in our system, and he's like, yeah, that would be a good idea. And then, we come back down for breakfast the next morning. He's like, hey, that idea that you were talking about, he was like, I coded that last night. It's live. Like, what? What are you talking? Like, it's crazy. And so when you think about why Devoted even exists, like you got to come to our house and hear the story, right? But, I think it's important for everybody to understand that, these two have such a unique experience in life and certainly in business, right? And how they look at things and the values that they approach it with. But, they founded Athena Health, which was originally for maternal care, right? To improve outcomes, healthier babies, healthier moms, all that type of stuff, right? Yeah. Clinically incredible, business-wise, not as much. You pivot that and make it one of the largest digital records companies in the U.S. Take it public, right?
Right.
Converging paths, right? Todd goes to become the CTO of the United States. Ed continues on. They come back together, and they say, we have there's problems, right? There are things like, why is this not working this well for the amount of money that we're spending in the United States for healthcare, right? Like we're going to spend a projected $4.9 trillion on healthcare this year.
Which is like such a chunk out of GDP.
That's like the German economy, literally.
I know.
Right?
And the result is like the episode of South Park, if you've seen it.
Yeah.
I don't know if you have seen it.
I do like South Park.
Accessing the American healthcare system.
Yeah. And it's tough, right? Like you try to go to the doctor, it takes forever to get an appointment, right? And I'm 40. Like I can deal with that. But it's like you don't see your doctor when you're sick, you go to an urgent care, right? Like the whole system has changed. There's so much bouncing around. So when you're 65 and older and you're making a transition, let's say from your employer coverage to Medicare, that's a nerve-wracking thing, right? Like you need, when I started in this, like I used to say, it was hard to find the information, right? In 2010, we weren't all shopping online all the time, right? So like
you're carrying around your roller,
right?
with like a billion plans, thumbing through provider directories.
Yeah, I mean, I was faxing and mailing applications and paper checks, and
I lived those days.
Like, and it was great, but everything has changed so rapidly, and so, anyways, they come back together after these unique experiences with this unique view. And they come up with the plan to fix U.S. healthcare. And what that is to create an insurance company. And where do you focus it? You focus it on Medicare. So Devoted as a plan exists for that reason, right?
Trying to solve a problem.
Solve a problem, right? And like we talked about, right? Our definition of world-class healthcare is the right care at the right place at the right time, delivered in a highly consistent and coordinated manner. It is not that we have bad doctors, bad hospitals, bad education, none of that stuff. It's just the way the system is designed, going back 100 plus years to fight infectious disease. Now we're not as great at taking care of preventative things. And a lot of systems now, it's like, it's an efficiency piece, right? You got to see so many people and there's not enough time in the day.
Yep.
So when you have Devoted, which has two entities to it, Devoted Health Plans and Devoted Medical, we can provide that wraparound service to help providers, right? We are not their competition. We want to help them do what they went to school for. They all chose to be a doctor because they cared about people, and they want to, help them get better outcomes. That's what we want.
Well, and sometimes it's about aligning incentives too, right? Where you feel like sometimes obviously the insurance carrier or the payer isn't necessarily aligned with, the provider sometimes, right? And so they're kind of at odds, in what they're trying to achieve. And it's like, no, we need to find ways to get back more in alignment to where we're working together to solve the problem, not like, there's not this push-pull happening, right?
You can't effectively do anything unless you're all trying to pull in the same direction. You can't have that division, that bifurcation of, we're a plan and we're a provider and we're a distributor. It's like, this is, the altruistic, like, fantasy land, but, like, I wish we could all just come together and say, like, this is the goal. Right? Like, the most important part, right? All these people have paved the way for us to do what we do. Every one of us have paid into, Medicare. We earn that. Hopefully it will still be there when we're ready to get to that point in our lives. But, like, they earned it. They need to be taken care of.
Yep,
and
I agree.
We all need to do a better job. So I think it's more of hopefully the rising tide, lifts all ships.
Right. Yeah,
And
I would certainly hope so, as well. The one thing I was going to ask you too when we were talking, off camera is, and I'm this is me speaking. This is not Matt. This is Dan. I am predicting that, you guys are going to more than double your membership this year. That's what I think.
that would be great.
So just in the sense of me looking at, the map and the strategy and where you guys are going to be and where you're expanding and what's just happening when we're talking about this year. And there's just so much chaos kind of happening.
Yep.
And so I think because of that, you guys will be positioned to more than double, which then again kind of changes the nature of the game and probably the strategy a little bit. And then also what's next, because, you have carriers that, they get to certain benchmarks, and then again, it's all okay. The challenges are different, whether it's revenue, whether it's utilization, it's all changes. But anyways, so talk to us about what do you think is, your take on this year, how it's going to settle, and what that's going to look like in 2025 and 2026 for Devoted.
Let me just break that one down for a second. I mean, I think this year is going to be so hard to predict what's going to happen, right? Obviously, there's already a lot of disruption. We are expanding, right? Our county footprint, once official, will more than double. Mm-hmm. So it's pretty massive. If we should be around available to about 37% of Medicare eligible beneficiaries.
Of the footprint, yep.
This year right now, it's about 28%, right? So it's a huge jump. You're no longer a regional probably at that point. You're getting close to halfway, right?
Yeah. And that's part of why we're doing such a call to attention to the broker community at large too, is saying like, hey, you may not have cared, maybe you didn't reside in an area, maybe you didn't need to worry about Devoted or didn't think about it, but as you all continue to grow, it should be more top of mind for a lot of these brokers.
Yeah, I mean, I think so. I think in my 2 years, which is brief, right, I've already seen a shift in that. When we came out of AEP Plan Year 23, right, we had done our 8 states, and it had been great. And, I was just kind of starting to sink into my role and starting to talk to people. And a lot of the feedback was, we know who Devoted is, but we don't know Devoted, right? Since then, we've put a tremendous amount of effort into that. But we've been doing that because we believe so much in the channel, right? Because the people that are in market, they know the members, right? And what we're trying to do is actually get people healthier. And we need those people to advocate and get them over to Devoted so that we can do what we do, right? And it's really more so insurance as a service is how I kind of would think about Devoted, right? Where, when you have Devoted Medical and whatever else it is, like we want the member to interact with us, which when I was, coming up in my time in distribution, like one of the first things we did as we scaled was create a service team, create a retention team, right? Like that's a lot for an agent or a small agency to have that kind of expense.
Right. And tackle it and build P&Ps and and we got to have our SOPs in place, and they need line of sight on this and connect with this department and that department. Yep. And I mean, there's more that goes into it than people probably realize.
And so a lot of the time, so we put a lot of effort into, just making sure we have the relationships with you guys. But at the street level, we're still investing heavily in growing our local teams because the grassroots, like I said earlier, is what it takes for us to be effective, right? Yep. Like we need Devoted is, you kind of have to get educated on it. When we talk about Devoted, if I were presenting right now to an audience, I really wouldn't talk about plans, right? Like, because I think agents hate sitting there and watching a PowerPoint of like,
and they're fairly commoditized, right? We talk about
it's
that.
like,
look, I used to talk to people all the time when I would sell, and I'd be like, hey, do you want a plan that's like really consistent, that's going to give you a great result, that you utilize, that you feel confident when you call? Someone answers the phone, they help you, and you can understand them, and they don't have a heavy accent, and they're offshore. And do you want somebody that you can actually, or do you want to be the client that changes their plan every year because it's going to be a difference of $150?
Yep.
Because when you're looking at copays and something's a $5 copay versus $0 or $35 versus $25, I mean, how often are you really going to the doctor? And at the end of the day, your MOOP is $5,900 versus $6,700. Right. I mean,
you didn't even get close to that anyway. What
how much does it change your life? It really isn't. And so I would talk to people all the time. It's more like, what do you want? You tell me. I'm just your broker. I'm educating
what's important
you.
To you?
Yeah. My job is just to find out like what's important to you. Okay, if that's what's important to you, I'm putting you on this plan.
Yep.
And if they absolutely, poop the bed, I'll be shocked. But this is the stable, great plan that's been very consistent, proved, tried, tested. Here's this plan for you.
Yep.
Now, if you want to be one of my switcher clients, then you just let me know, and I'll just put you on my list every year and plan on changing your plan.
Yeah.
You know, but
And
like,
I mean, I think going back to like the last however long, like that's part of what the issue with the way things have functioned for a little while is that with all the benefits and all these things and the, you know, making sure you're getting what you're entitled to, all of that, it's like if we train our new agents who are entering the space to sell only on that, right?
yep.
You are unintentionally or accidentally then training your member, your client, to think about it
It's
that
such
way
a disservice.
in a transactional matter,
Yes.
right?
Well, and here's what maybe people don't understand. You and I do. Other people don't understand this in that, look, for a long time, when you enroll somebody on a plan, there's no claims data,
Right.
you know? So like the health plan, they don't know their specific conditions, and maybe there was an HRA or a VBE. Did the carrier even do anything with that data? Maybe
Right.
not. And then you have to wait for claims, and then that person has to get used to using the plan, actually filling their meds, and then there's like, oh, we have claims data. They take these medications. Oh, we know they have probably these health conditions. And you can start managing it, and do they need home health care, and like that clinical side of it. And then that person, honestly, brokers should be ideally putting people and saying, like, you know, do you want to go to the pharmacy every single month, or do you want to do 90-day mail order? Like, put them on the 90-day mail order. Do you know how to go online and register and view your claims? Do you know how? So like once somebody gets in that whole ecosystem, right, and that member knows how to access care, is able to go where they want to, where they need to for care.
Yep.
They know how to get their prescriptions and view, you know, where they're at on their year. I'm just thinking about the Inflation Reduction Act now, like where they're at for the year, you know, close to the gap or not, or, you know, which will look very different next year. Are they to that $2,000 mark?
Yep.
Anyways, but just like knowing that and being able to see their claims data and be there, that's when we talked about, that's when utilization can start going down a little bit, and you can actually manage the member. The problem is so many plans never even get there, and the member never even gets to the point where their health plan can be like a real coordinated care plan or manage them. Because again, by the time they're on a plan for 3, 6, 12 months, they're changing plans constantly. There's not enough information to even do anything with it.
Yep. And, you know, if there's a doctor change or a network change with all that, you're basically starting from scratch, like, in a lot of those scenarios. Like,
every time.
How do you ever expect
The broker starting over, the member starting over?
Right.
Like, I just think,
and like how as a broker, how are you growing your business? Right? Like the amount of time that consumes
right.
to do all of that. Like the stability is the key. Like that's what we need. That's what the members need. And that, you know, approaching it that way. We're not the best plan for everybody, right? Like we get that. In some areas we are, in some areas we aren't. But it's like you said, like every human has different motives for why they purchase or how they make a decision.
Yeah.
Right?
Absolutely.
And like I had the good fortune to learn from some very good sales leaders over my career, right? And I still use this because I believe it is my definition of sales is helping someone make a decision.
Yeah.
And especially in this, where it's
There's going to be a lot of
changing
education.
and all, like if you're a broker right now, start talking about what's going to be expected this fall, right? Like get in front of it. But
So what are, look, you kind of opened it. I don't want to let you off the hook for future because I want to still hear you on that.
Yep.
I'm going to circle back to that.
yeah,
but
you got to keep me on the rails here. I'll go everywhere.
I will. But since you already brought it up with brokers and what they should be doing, there's a couple big things, at least on my radar, and things that I think about. And we're actually probably going to do one more podcast episode where we actually talk about, hey, here's like your playbook and all the things you need to do with a lot of specifics to have a successful year.
Yep.
You know, because what we're looking at, like at a macro picture, like our organization, and we're having to start to track all the different SARs and the areas and the membership that's impacted.
Right. And,
you know, number one, like take care of your own and find a home for those people and where they need to be. But then also having a growth strategy. There's a lot of different aspects at play this year that just were not there last year and the year prior. So the playbook looks a little different.
Yeah.
What do you think are some of the things that a broker should be doing to have a successful year?
I think if you don't work it with a plan, it's going to be tough, right? So I would be looking at my book, looking where everybody is, probably evaluating their prescriptions, paying it, those EOCs will come out and, if there's big changes for certain drugs, like know who in your book's going to be affected by that.
Yeah,
right?
like we're
what
talking
they need to do.
GLP-1s this year too, and which tier they're going to be at.
Yep.
Yeah.
So, do your homework now, right? Try to understand what's happening with IRA, right? Try to understand what's happening with V28, like all of these things. And
those are important. I'm going to pause so that people at V28 and the Inflation Reduction Act are very, very, very important things. Are you on the spot? Are you comfortable talking just slightly about V28?
I mean, at
Broad
maybe
cliff.
the highest level, I definitely would not be
High
the
level.
world's foremost.
Sure.
But it's essentially changing, like coding. I'm blanking on the word, but like the risk adjustment, right? And so
The methodology
of
to the risk
it
adjustment.
and how things can be filed, and it's going to change a lot of the way that
So
there's operations.
And like I'm okay just saying this. There's like a big lawsuit right now, happening.
Lawsuits.
Challenging. United Healthcare is in the media right now, but again, I'm not picking on them. They're in the media a lot, and they're just so large that that I think that legal. I have a mantra like the bigger, more money, more problem. The bigger you are, the more legal you're always going to have.
It's like buy a big house.
Yeah,
you're gonna have
more taxes,
more stuff to deal with. Right.
It's just how it is. So like with litigation and lawsuits, it's again, I'm not picking on them. They just have.
You can't. I mean, nobody's in this to
right.
Everybody's doing the right stuff.
Yeah,
right? But it's like you said.
But they have a lawsuit right now from the government about upcoding, and things. And my perspective is, well, look, they were just following the kind of the handbook that you gave them. So it's kind of like if you don't want a certain outcome, then don't place the financial incentives and the systems and the rewards and everything that way if you don't want it to happen that way, right? So we always say, show me your comp plan, I'll show you the behavior, right? And so,
exactly,
now there's a lawsuit for the upcoding, but, V28 will very much challenge or change the way that the risk adjustment, the RAF scores and the risk adjustment factor and how it's happening and how those plans will be compensated. And so that is going to be a more challenging dynamic moving forward.
So when you put all those things together with, higher utilization coming out of COVID and, not getting as much of an increase that you would have been used to from CMS, like it's just it's a lot of stuff going on, and it's going to it's clearly creating disruption. It's going to in the fall, not to mention an election year. Like, be good at helping your members understand that really the outcome of the election is not going to have any impact on their plan choice for the next 12 months or probably even a number of years, because
it takes a while.
It's a cruise ship, not a speedboat, right? Like, it takes a while for it to make a turn and get anything implemented.
Correct.
So in this year where most people are saying there's going to be more shopping than there has been in 10 years, maybe, I don't know, maybe ever, I'm not sure. Like, people can't sit on the sidelines because there's going to be such a glut. If that happens after November 7th, there's going to be no way that gets done.
And I'll tell you what, like I'm just adding to this, like, and we've been talking about it on our show, like every single week, we do these episodes, and I am personally almost so sick of talking about like the call letter for next year, and the lawsuits and everything happening because of all the uncertainty. Because we're not trying to like fearmonger, but we're just like, oh my gosh, there's so much right now. And I will say though that now that we've been talking about it, and now when I've actually started to get communications from carriers with specifics, when they're like, oh, actually, here's the areas impacted, here's your specific book of business, here's the actual numbers. I've just sit back and like, damn, it's a gut punch. It's even worse than I thought it was going to be.
Right.
We've been talking about this, and now when I'm actually seeing like the data in front of me, the counties, the states, the numbers of the impacted members, it is much larger than I even anticipated that it was going to be. And so that's why I'm not trying to.
You think we're doubling?
It's well, and we're actually to the that's why I say I think that you're doubling, because even me, we were starting to add up all of the body count. We're going through like, oh my gosh, okay, we got this many members with this particular carrier in this particular state. where do we already think, might be a good home or an alternative plan for these people? And as we're looking, like our org, I think we're going to be starting from about 10,000 in the hole. This AEP for us. Yeah. I mean, there's
massive.
There's organizations obviously a lot larger than ours,
sure.
That are huge numbers that I don't
it's
even
all
know.
relative though, right?
Yeah, I don't even know that they're going to be able to get to them all. I mean, and we look at what's our bandwidth and our capacity to do enrollments. And so I look at it and go, okay, like I think we can do 30,000 enrollments this AEP, our organization.
Yep.
So if I'm starting from 10,000 behind, now how many of those 10,000 members can I actually reach and communicate with and change their plan to? Yep. Like how much am I going to retain of that? I don't know. TBD, right?
Yep.
But for us, we're going to have a great growth year with all the disruption. But but I also think there's individual agents that might be sitting in geo areas that cannot get to an entire book in one season, and there's other organizations who are not. But it is going to be a very big opportunity for a lot of people.
I think certainly. Newer agents without those big books of business, like
they got a lot of runway.
You got a lot. You could build this year.
I mean, we talk about a lot on how hard it is to be in the business. I think the last 2, 3, 4 years of starting from scratch and having prorated commissions and all these other elements. And now we're talking about, you get $100 raise. No, just kidding, you don't get $100 raise on your FMV. Hey, we're going to pay you for VBEs or HRAs. No, we're not. Maybe we are. Just kidding. Possibly. I mean, there's a lot of uncertainty, but. Again, to our point, there's uncertainty, all these things, but there's a lot of opportunity and there's a lot of runway that a newer broker can just go 100 miles an hour right now.
Yeah, and I mean, again, embrace the suck. Like things like this create opportunity, right? Like work through it, stay with it.
So, 2 things I want to follow up on before I lose track. Where do you think the Devoted will be? Here in 2 years, ideally. And I'm sure you've thought about it, where you kind of, I think ahead of like, here's where I'm deploying capital. Here's where I'm doing things. Here's where I want to go this next year and the year after. As a leader of our organization, that's what I do. I'm sure you think about that. So give me kind of paint the picture where you would hope to see Devoted in the next 2 years.
I think from my seat, personally, I want to continue to try to focus on our partner experience, our broker experience. Like, not necessarily the brokers. Like, we have a whole team of people that really take so much time and care and attention to making sure that we can do things in a way that makes sense, right? And getting feedback. So.
And by the way, I could think of 4 different Devoted reps, like in particular states and markets right now that I know do that and do an excellent job. And it's like, I already am thinking of some of them right now that just do a wonderful job.
Our teams are, I mean, I'm partial, obviously they're incredible. I think they're the best, but, we provide this, member experience and the broker experience of, we're answering 90% of our calls in 30 seconds.
Yep.
With 100% US-based customer service, right? With 90+% first call resolution, So there's that piece.
It was 94%.
Thank you.
I read.
Bumped me up a little bit. When I say these things, though, too, like coming from a sales background, right? Like, again, I was taught to think like, all right, your value prop and you're saying all these things. What you should be thinking is, this person is just saying, so what? Like, what does this mean for me, right? Like, if I'm a broker, I'm saying, well, that saves me X amount of time sitting on hold or having to do this. Like, with Devoted, you really don't have to deal with a lot of that same type of stuff where we're making more outbound calls than we receive. And I've gotten a lot of questions about like the like, well, you're not going to be keeping this service up. Sure. Like, well, guess what? We went from 140 to 201,000 in AEP, so January 1, and our answer time actually went down.
Yeah, because there's some economies of scale.
Right. So
if you do it right, you can leverage.
Do it right. And the whole thing is like we get people healthier over time. So the longer with us, they get healthier. So anyway, going back to where I see it, I would like to build, the same partner level experience at this level, certainly, and create that alignment that we can continue to work, at the market level and have those incredible relationships and understand, but also work with you so that we're very coordinated across all of those places as we try to grow and be as efficient as possible and look for the places that we can help you guys and all of our partners and, what makes sense and what doesn't. From an expansion standpoint, I mean, we're not going to make any bones about it. Like, at some point, we want to be fully national.
Yeah.
What I love about it
Love to hear that.
We're not, this is, again, my view. I don't think we will grow just for growth's sake.
Right.
Could we have done states last year? Like, maybe, right? I don't know. I don't know the answer to that question. But what I heard consistently is that we will not take the risk of jeopardizing what our current membership expects from us, what we tell them we're going to give them just for growing.
Yeah.
Right? So if we can't do that, then we're not going to do it. And so I think that, kind of methodical, consistent approach will continue. I think that we're starting to get to that kind of tipping point, that bell curve of where it's less about who Devoted is. Now I think as we enter new markets, people kind of know who we are. And I think that there's been some hesitance to, a new entrant. You kind of want to see how they perform. Are they going to be here for the long haul? Like all those types of things.
They've been burned before.
Yeah.
Do I trust them or not?
Exactly.
Yeah, if you're a broker, somebody's burned you before. I could name names. I've been burned by some.
Everybody has, right? And so, you get one chance to make a first impression, and, we're trying to do the best job that we can at that. And so I think that slow and steady growth to being fully national will continue. I don't know
I would
what
imagine
it's like for next year, but
this year I know you have some DSNP offerings
Yep.
in some areas, and I would imagine just looking forward you might have more product delineation, maybe some more DSNP, CSNP. I would imagine.
Yeah.
That's just me looking ahead at
they're popular plans, right? They're it's a population that I think for us really resonates as they need somebody there to help them with that, getting them healthy. And it's probably, a population that honestly is overlooked in a lot of facets of life. But again, going back to, they paid their taxes into this program just the same as anybody else. Right. So let's take care of them.
And the one thing I will say too that I've noticed with Devoted is that candidly, and the only other carrier I would really say that understands this, United Healthcare has done a great job of understanding that they're, if they win the broker and make the broker experience and the distributor experience great, then they're going to get the business, right?
Yep.
They understand that well with their technology, and I would say Devoted, same thing is. You guys understand that you're talking about the experience and the relationship and distribution in the broker community, because when all these companies really take a hard look at all the numbers, yes, everybody wants to just have somebody see something online and sign up directly. But the reality is it's a complicated, nuanced product and sales process, and it's not as easy, and they need somebody to kind of walk them and guide them through it.
Absolutely.
It's a more kind of difficult transaction.
Yeah.
And so because of that, you all have done a great job too to say, hey, if we do a good job of making that broker onboarding experience, great technology, easy to do business with, XYZ, then you're going to get the business. And that's the other reason why I'm saying that I think there's plenty of maybe smaller carriers, regionals, and even some of the bigs that are exiting. And when I'm thinking ahead of what I know about the industry and the broker community, is they're going to go for, the path of least resistance, is what is easy for me, what is convenient for me. And I think that you guys have done a great job with that experience.
Yeah, and I appreciate that, and I can take no credit for that.
Well, it's funny because so even before you came here today, I walked the floor a little bit, and there's two guys over there wearing Devoted shirts today on our sales floor. just, and I didn't pay them, and I didn't bribe them or anything. They just showed up to work, and I was like, oh, dude, kick ass! Like, there's actually someone from Devoted today.
Sweet.
And they're wearing, because you guys send out swag, and you guys had what do we call it? We don't call them broker bucks, or what is it called?
Yeah, broker bucks.
Is it really? Yeah. So obviously they've sold some Devoted plans. They had their broker bucks, and they have their shirts on that they got for free with their broker bucks. Hopefully CMS lets you get broker bucks still next year.
No comment.
Don't go too wild, Next thing we're talking golf parties.
Yeah, that's right. We're not doing that, yeah.
But no, they were wearing their shirts, and I was like, dude, hey. So I said, obviously you guys have sold some Devoted because you have broker bucks to go buy the shirts. I said, what is it like? And they're like, oh no, it's great. Like I said, have the people, did it get effectuated? When you wrote the policy, did it go into effect? How was the experience? Do your members like it? How was it doing it? They're like, love it. It's all good. Love it. Whenever there's a footprint or a county, it's one of the first plans I'd look for to see if it's available.
Yeah. I mean,
so
I'm going to have to go give them a high five over there when we're done here. But that's really what we see, right? Is, we'll enter a market, and we've basically kind of seen the same ascension growth in almost every one, I think, where it's, the new entrant, some will dip their toe, right? So for every, let's call it, activated producer in a new market, we might average like 1.5 to 2 enrollments in year one. And they'll try it, and they'll say, come January, phone's ringing, people are having questions, right? Like, we're using this, I don't know what's going on. And generally, I think what happens is their devoted people are pretty quiet because we've probably hadn't called them 4 times, right? Yeah. Making sure they're getting all their stuff, getting their appointments made, doing all those things. And so then I think the broker sees that. So we kind of see that jump from, 1.5 to 2 to like 6.5 to 7 in year 2. So like, get in early. That's my plug, right? Like it continues to ascend. So believe it, like test us. Sure. Like everybody handle your business the way you want to handle it. But we've been tested now in 13 states. Yeah. And we're still going.
And you guys have a great, we call it's NPS is the acronym. And I, by the way, I've had a lot of people commenting on the podcast and say, you guys use like a ton of acronyms. Can
NPS.
Yeah. Like a net promoter score.
Yeah. And what I always joke about that, because ours is, you probably know it, like 68, 70. Thank you. I always say, 70 is not a C minus.
I know.
Right? Like
that's what I would shoot for in school.
Yeah, right. Yeah. Don't look at my college transcripts. But net promoter score is a scale of -100 to 100. Mm-hmm. And anything I think over 65 is considered world-class customer service.
It is. And I think I'm glad that you clarified that too. And that's the reason I brought it up is, joking about the acronyms, we get all these comments, people like, can you guys just like speak English and say things so I can understand?
We don't need any more 3-letter acronyms. I can tell you that much.
Or whatever else. Yeah. But I will say, I love that you define that because really when you start to look at the numbers, that's incredibly high.
Yeah.
And so that's going back to like, and it's almost like your caps and your so I can't remember to whoever's listening about caps, the consumer something health score. Anyways, but all extremely high, which just kind of goes to show you that, when you're surveying members and saying, hey, how do you feel about your health plan? And, X and Y and Z. You guys also have great statistics about the few people who do leave and a very high percentage of them coming back to you.
A lot of boomerangs, yeah.
Mm-hmm. Which is really good.
Yeah, it's great. I mean, just like anything else, people try things and maybe it works, maybe it doesn't. You come back. That's fine. But yeah, the net promoter score, right? That's a scale of how likely you would be to recommend a service to a friend or family member. That's what it is.
Yeah.
And so everything that we do is centered around doing what's best for the member, right? And that also, though, includes taking care of brokers, includes having incredible partnerships with providers, right? Like what I said earlier, right care, right place, right time. You can't do that if your pre-auths take forever. How do you
right.
Like, so our pre-auths are 24 to 48 hours, I think, on average, right? Like there's like bills being written to mandate a certain right, and we're already doing it. Like our system, we automatically send people the benefits that they may not even know that they are entitled to or that they're getting from our plan, right? Like we're sending them their food. Like, go get healthy food because we can't get you healthy unless you're using these things. There is a point. Yeah, why these things are in there.
90-something% of people are eligible for the grocery benefit. Is that SSBCI or how's that filed under? Do we know?
I don't know. I have no idea.
But hey, like 90-something% of people are eligible for groceries on devoted plans.
Yep.
You know what I mean? I do know that.
I think it was like 94 or something like that. Yeah.
It is interesting too. We've talked about all the benefits. That's one of the weirdest things, where, when I was at your kickoff this year, the food is health, guy was there.
That was super interesting.
But it is true. Like you think, like I'm a car guy, and you think about like gasoline and maintenance and things you do to your car, and you're good in, good out,
right.
Sort of a thing, and and it is. And it's good to see that a health plan is helping people with food. It's always been interesting to see, like, okay, I can get behind things like dental. Yeah, you got to have dental hygiene, or else it affects other parts of your body.
Yep.
Vision, yes, you need an eye check. You need to get glasses. Eye exam. Vision needs to be a benefit. Mm-hmm. Hearing needs to be a benefit. Mm-hmm. Understood. And grocery, but then we had kind of veered off for a few years, into like. We're talking wild benefits, pick your package, from, even like the PERS systems to like the pest control to, a swamp cooler unit. Just outlandish things that are quite wild, right? I give carriers a hard time about I call it Teddy Ruxpin. I don't know if you
I had a Teddy Ruxpin.
Did you actually?
Put the tape in the back and he talks to you. Yeah.
The little pet, I don't know if you knew like the pet kitty or puppies, some of the carrot, and we're like, oh my gosh, you got to be like kidding me, So it is good to see some of that swinging back to norm. And the reason before we wrap is bringing it back to there is I think that we're going to see, we're talking about this big reset kind of in the industry with insurance and with Medicare. And this year, like I'm trying to set the table for this is what's going to be happening. Yep. Like whether you're expecting it or not, I wouldn't anticipate brokers for their clients being able to have them get their e-bikes paid for, their season passes for skiing paid for anymore. Yep. All these wild things, like we're back to reality, to where it's going to go back to core benefits, things like food, dental, vision, which is great to have. Yep. But I think that's going to be that cut point. I don't think we're going to be able to have the dollars for all those outlandish benefits.
Yep. But I think that's a lot of what's fed into that transactional nature of changing that we've seen so much in the last 4 or 5 years, where it's like that looks cool, I'll try it, and so I'm everybody's going to have some benefit degradation, right? Everybody is. So I'm actually excited about that. Like,
it's cool you got your e-bike from your health plan. Now when you crash on it, what's it going to be like when you
go? Right? Like, can you go to a doctor with that? I'm not sure. Yeah, so I think it's going to be, again, it's a short-term pain, but I think long-term that's going to be a plus.
Yeah. What do you see, any predictions at all or able to share? You have been in some meetings behind this. I'm always curious, if I were a fly on the wall in some of the meetings that are happening, just kind of describe maybe some of the dynamics or how challenging it's been this year versus others with, regulation and, all these rules and lawsuits, and we're going this direction, but then we don't know if we can go that direction or that. Is there anything you can really speak to?
Remember my frame of reference historically, first off, Devoted's only about 6 years old, right? 7. And I've been there for 2 years, and I came from, the other side. I was on distribution, right? So, but what I can tell you is I think one of the most challenging things is, especially for the last 6 months, right? Like I talked to Mike very frequently, right? And I think what was hard was, everybody was looking for an answer, and nobody had it because I don't think anybody really understood what was going on, and it was a tough time for us. I think the dynamic is like we want to do things, but strategically, like, we're a pretty small fish in the pond still. So if we came out with something that was like just totally way off base, right? Like you run the risk of alienating people, right? Yep. But if you come out on the other side too aggressive, like you could run the risk of hurting, so it's like you have to watch this balance of those two things. What I would tell you about what happens like behind the scenes, and this is not BS, is it's always just, it really comes back to that prime directive. Like, how would you want that decision to be made if it were so we really do take into account every stakeholder of how those things can be affected. And, we move pretty quick, right? Like they'll always say, like, start with the easiest version of the hard thing. And that's probably what some approach would have been like, is like, let's put something out there that makes sense and then tweak it and make it better and optimize it. And then eventually you get to a point, right? But with all this change and things that have been happening, like, not just us, but everybody needs to have the opportunity to put things out there and have this entire community say, like, we're all going through it.
Right.
Let's continue to tweak it and make it better and get to that point. So behind the scenes, like, it's, I just feel so fortunate. First off, like, I get to be in meetings with such, like, insanely smart, talented, and caring people. And I don't think we've ever come out of it, like, thinking we're making the wrong decision. Like, obviously, yes, like, it's not a charity, right? We have to keep ourselves in business and, you know, stay viable and do all of those things. So you have to take into account your own self-interest. But when you're trying to do what we're trying to do, I think the way that we approach it makes it kind of almost easier for us to make some of those types of decisions, because it's the North Star is the same. So as long as we can continue to focus on the members, you know, I think it's, you know, the conversation is generally the same. We start with the member and then we kind of work it out from there and see how it might affect it, and then affect the next layer and the next, and try to take care of everybody the best we can.
Yeah, and part of it is, a big part is timing this year, right? Timing it. And the one thing I'm going to call attention to is, you know, it's just like a stock, man. You could love a stock, you know, like I do all the time, and I love a stock, and I go, it's 26 times earnings. I'm not buying, you know, but I love the stock and I love the company, and it's all about the timing and waiting for it to have a rough day, and, you know,
buy the dip, right?
Yeah, exactly. Or put in your put or whatever you do. But even though you love the stock, you know, timing matters.
Yes,
right?
It does.
And so I think that game is going on right now, and I'm trying to bring more awareness to the broker community too, because I've had agents this year who haven't really been paying attention to a lot going on, and they're going, dude, where are the first looks? And, you know, you send in the first look and you go, well, what the hell, Dan? There's nothing here. There's no numbers. And it's like, you're probably not going to get numbers until end of August, early September. You know, like, that's the reality. And I said, well, just deal with it, because if you're selling ACA plans, you're used to, like, the window shopping, like, where you find out, you know, premium amount and stuff like 2-3 days before. That's all the time you get to prepare. And so I think that, you know, with everything that happened this year with, you know, like the rebid, everything else with benefits, that, you know, obviously brokers are not going to have the time this year. They need to start going back to our conversation, just holistically looking at, you know, plans and companies and coming up with the strategy, being able to just move forward and have a plan that they're creating and moving with. They can't just sit around waiting.
Right. I mean, at very least, you're going to know who the players are, right? You're going to know what your options are and who's available. And, like, that stuff's going to come out eventually. I just think that you got to understand your own book, and have a plan for that unique book and the way that you approach things. And then once those details come out, then you could try to pair it up and make any, you know, updates to your plan that you'd created. But I mean, it stinks. Like, last year we had our first looks out like June 20th. You know?
Yeah, people are not going to have 3-4 months, you know, knowing that information this year. You're going to get like a month. That's probably going to be standard. And the other thing that I'm going to call attention to is, look, we always say, when you have good news, usually you go to the market early because you have good news, and you want the whisper campaigns, and you want it to disseminate throughout the communities, and you want that traction. And, you know, usually if you have news that's not good news too, like for some of these interruptions and things that are happening, that some of those are getting held very tight to the vest right now. And so I think a lot of that is still going to be coming out over the next 30, 60 days. And I think some brokers and agencies and people in the distribution community are still going to be blindsided and surprised by, like, just some bombs still going to drop over the next 30, 60 days.
And that stinks. You know, it's like, nobody likes bad news. People hate surprises, right?
That's true.
That's the key.
It is. Like, I agree, because I would rather have somebody call me up a month in advance or 2 months and say, hey, I got some really bad. In fact, when I even do coaching sessions with people, I tell them, like, hey, I'm just going to hit you with it straight. Just I think people appreciate that.
Absolutely.
You know? And I've been known to, you know, ruffle feathers, but I'm a very direct person. I'll just tell them completely. Cause I think, if I give people my honest opinion and whether they like it or not, that hopefully they'll at least respect it.
Yep. And I'm probably the same. What I learned about that, because I do think that's the best way to do it. And like
transparency.
To grow, you're gonna take some lumps, right? But like, there's a couple of things that I used to really focus on after my first year of managing people. I got destroyed on my review. And I'm sitting here thinking like, I did a pretty good job. Like, I think they like me. And it was like, oh, man, maybe I'm not cut out for this. But, I thought about it. I digested it. And, I think it's a lot about, I would have sold with a lot of vulnerability, right? Like, and I think it's important in those types of relationships to have that accountability. But, the first question I would ask was if somebody, if I had a new member on my team was, how do you like to be coached and how do you like to be managed? Because they're two totally separate things. Yeah. Managing is watching the clock and time card, doing all that type of stuff. Coaching is different. And great, tell me that. Cool. Like, here's how I like to do it. And here's why I like to do it that way. Can we agree on the best path forward for us to do that, right? So then when you have that tough conversation, you say, hey, you remember when we talked and you agreed that I could check in with you on these few things? Well, yeah. Okay. Well, we're going to check in on those things. Like, so you've already set the table.
Right.
And again, don't like bad news, hate surprises. Same thing.
Yep.
Right?
And there's still going to be surprises, which we already are talking about.
We're all human, These partnerships are awesome. They can be challenging. But partnerships, both sides have to win, right? Otherwise, it's not a partnership, right? Yep. Like, so it's not always easy, but we always, try to work together to make the best outcome for whoever it is.
Yep. So, and I agree. I think you guys have done an excellent job. Before we, I told you before this that almost all of our listeners, a lot of them are brokers.
Yeah.
And
you guys have been getting traction too.
Yeah, they all have ADHD or ADD like I do, and
me too.
Whatever. Yeah, so they don't listen for too long. So we're like probably coming up on time, but we've been adding about 1,000 subscribers a week, something like that. Is that right, Matt? Something like that. We've been adding like 1,000 subs a week, but a ton
super impressive
in listens and everything else. Yeah. So anyways, it's been great to kind of get that traction, and I think just from my perspective, even doing this podcast was more, it just didn't exist in the space, at least not from a credible source. Mm-hmm. I didn't think, and there just wasn't a good avenue for people to really get what I would call like legitimate information.
Yes.
And so we wanted to start doing this just as a means to communicate with our brokers and distribution and everything else. And it's now evolved into more just almost for the industry. I can't tell you how many time people are like, hey, hey man, I listened to your podcast episode last week, and I'm at a national event, and it's like another FMO or somebody, or they're texting me, and they're like, oh yeah, I can't comment on your thing, but like, I text you about it, on the side, whatever. Yeah. So a lot of people listen now, which has been fun.
Important, right? Like, it's like, where do you get that kind of like unbiased view of what's happening? It's like, newsflash, like I do visit senior insurance forums occasionally. Right. Like, I know. I see what, I like to see what people are talking about.
Yeah, it's funny. If you get in those threads, it's hilarious.
And there's a lot of misinformation. There is. Just like a lot of other things, it's just this echo chamber of like,
that's what's frustrating to me, man.
Yeah.
And people don't know, when we do these podcast episodes, we're like, hey, are we going to talk about V28? Are we going to talk about RADV? Are we going to talk about like, whether it's net promoter scores or whatever we talk about, but just know that I'm not going to be talking about something, or if like I'm going to say, hey, you know what? I can give you the third grade version of that because that's my extent of knowledge to it.
Yeah.
But I really do feel like if we're going to have a guest on or a topic and we're going to talk about it, I'm pretty well versed, so we can have like a very good, knowledgeable, educated conversation about it. Because if not, you're not providing any value, and that's going to be more of the misinformation that's out there on all the forums. And I sometimes think to myself like, oh my God, who is this person aligned with? Like, who is their agency owner? Do they have an agency? Yeah. Why are they thinking this? And how are they even doing business this way?
Yeah.
Yeah. But anyway, that's neither here nor there. Topic for another day.
You guys are doing a
guess.
good job. It's been a lot of fun to watch it, as it's kind of, like I said, you know, getting 1,000 a week. That's pretty impressive.
Yeah, on subscribers.
And I think, you know, that just, you know, I think it's authentic, and what you guys have built here is very authentic. I've, you know, from the first time I talked to Mike, you know, and he told me about the, you know, how you guys approached it, just always really appreciated, you know, what you guys have been trying to do, and, you know, getting to continue to build this relationship, and, you know, talk whatever, you know,
hey, so let's do this.
Great.
We're going to wrap this episode. Cause I think we're at time, and whoever it is, I'm supposed to be on a Zoom 2 minutes ago. But we'll wrap this episode. But hopefully, we want to have you back before the end of the year. So maybe we can do a round 2.
Yeah.
And I'm just going to call it that we're going to have a great year overall, and we're going to have a great year selling Devoted. Yeah. So appreciate the partnership, man, and really appreciate you coming out.
Yeah, appreciate it.
Thanks, man.
Agent Boost.